This probably honestly is the one I've used the most by far because it functions as a really good muscle energy technique for the quads in general. Okay, so for usually the culprits of dysfunction here are rectus femoris and vastus intermedialis kind of getting stuck to each other. More common is vastus lateralis and IT band getting a bit fibrotic, right? So what that'll usually present as is the lateral side of the leg feels more toned and it's more sensitive. It'll feel more ouchy as you try to work this. Okay. If a person shortens what you're pushing on, it will usually make, if that's sensitive, it'll make it feel better because the shortening of the tissue is kind of pushing you out of the area a bit, all right? And the receptors in there are kind of getting more room as opposed to when you squash them, they're getting smushed too. So incorporating active movement can be a way to work on sensitive areas and actually have it be less ouchy and get the response to occur more quickly. It's gonna be much more brutal for a person. They say they got tight IT bands and all that, and I come through and I'm working along IT band and then especially the line between IT band and quads, and I just keep on gliding and keep on gliding. It'll be a journey for them and they'll feel like, yeah, I'm doing deep tissue, myofascial stripping, something, right? I could get, and I'm saying from my blessed opinion, that it's way more efficient and more kind in the event that you find stuff there to apply inhibitory pressure. On vastus lateralis, it's a pretty big muscle, so you can be a bit more lateral, a tiny bit more anterior. You're just gonna always be on the lateral side of the leg. Have them, and here's the big trick with getting this to activate better, is it's not kicking your leg forward like this. It will activate some, but you're gonna get a better activation of this if they keep their heel down and they push the back of their leg down into the bolster and straighten their knee that way. That's more reflective of standing up like out of a squat in loaded gravity as opposed to like the swing phase of gait. Both of which could be a thing, but you're gonna get a more profound contraction by having them flatten their knee against the bolster. Okay, so I am going to assess medialis versus lateralis. All right, okay, so here we go. Lovely leg. Kind of showing you like the hamstrings. Look at that split. There's gastrocnemius coming right up the posterior side. How the hamstrings come together, attach up onto the ischium. All right. Now, here's our quadriceps. Let's get sartorius out of the way. Rectus femoris. This is tensor fasciae lata. Let's get it out of the way. There. Now, underneath of this would be vastus intermedialis. Rarely do these models like really show it very clearly. But here, vastus lateralis, vastus medialis. Look how the belly of medialis is down here, closer to the knee. Lateralis, a bit more uniform, thus the belly of the muscle, the thickest part of it's gonna be somewhere more here. So I'm not gonna get an accurate read if my hands are like this. My hands have to be crooked. I have to be feeling closer to the knee on the medial side and higher up more in the middle of the leg on the lateral side. If I'm gonna get an accurate read of this, right? Now, have you ever looked at a bodybuilder and seen how they have that big medial quad thing? You know, you don't achieve that. They're gonna build strength and actually be able to lift heavier weight. I mean, you need this for quality knee function, right? So that's what we're feeling for. We want this to fire first, this to fire last. But it's the hand placement where people go wrong, as well as sometimes not having the person do the knee extension pattern into the bolster so you get a better read. So my hands have to be like this. If I'm standing here, I'm not like this, I'm not like this, or even better, one hand, the other hand. One hand, the other hand. So patella, find the patella, say hello. Hello, patella. You can even do a quick assessment here. How mobile is said patella? Can it move up and down? This one not as much. You can plant your hands just superior to the patellas and look at your alignments and see if one's higher than the other. This hand for me is higher. That tells me these muscles are pulling up. So the most common reason for patellar tendinitis, ouchie here, is these are too short and they're pulling on this. And that pushes the patella, it brings the patella up and also pushes it down. So we need to release here. Okay. So our assessment's gonna look like this. And we coach the person to do that action where they straighten their knee. Perfect. Just like that. Relax. Okay. Medialis, lateralis. Activate. Cool. And relax.
Which one's first?
Now I'll tell you, for most people, if you can at least even feel medialis firing, that's better than most.
Do it again.
So again, activate. Okay, pretty co-contraction. Not bad, not bad.
That's not good, is it?
You want the medialis file?
Okay, so finding the patella, medial,
Yeah.
lateral. All right. Okay.
Things make me so let's work out this morning.
Already got a little bit better. You're strong. So now some people, the medialis is barely there.
I'm trying.
And it's just a normal thing. Are we having a harder time finding it?
Yes.
Yeah. And that's more normal than most. Now here's one where I really tell you it's always going to be good for a person's knees for that to be more dominant. My pattern and cycle here tends to be I externally rotate their leg, I work along that medial line. I'm getting the adductors a bit when I do this, but I'm thinking more about just pushing the adductors away from the quadriceps group. Okay, so I'm just trying to push that all away, and then I turn them this way and I work right there, just anterior, up rectus abdominis, rectus femoris, rectus femoris. Then I'm here to go more lateral. And once I'm here, I almost always know, especially if I'm with a client that is looking for a therapeutic change, I'm gonna find something. And then I coach, okay, flatten your knee. And relax. Now my forearm is on lateralis. I can feel here. And this is a place where I'll use a bit of manual vibration, more almost like percussion, but I'll kind of dysrhythmic will wake things up. Rhythmic, I mean any kind of percussion I usually think is waking stuff up more, but rhythmic is going to be more relaxing. But I'll use a little bit of a or it was a kind of a while they're doing the action. If that's not firing well, this is a place where I'll use percussion as a way to create sensory input to help a person facilitate activating that muscle more efficiently. Yeah, that sentence came together okay. All right, what it turns into, inhibitory pressure plus active movement, so flatten the knee. I'm getting a lot of stuff all at once. Relax. I'm getting a nice contract relax on this vastus lateralis. My angle of force is pulling that away from my T-bands, so I'm hopefully getting a myofascial like displacement here and getting those separated. The activation of the muscle compared to the IT band is going to create some friction and get that freed up also. And then I'm also having a conversation between this muscle and this muscle that you should be more dominant and you should shut down a little bit more. Big win for just what ends up being compression. All right, flatten your knee. Okay, relax and move up. compression, flatten these, yeah. Relax.
Top.
That one got it.
This one work, okay, I found a tender point.
My legs today.
Okay, flatten.
Like,
That should make it feel better.
Mhm.
It's substantially less sensitive as soon as they're shortening that.
It's the letting go that's
And
harder.
slowly let go. Control the eccentric action. Okay, again, flatten.
Is he going from here? Yeah.
And then slowly. Any change?
Mhm.
Much better. Usually I can see their face. How much of a furrow brow do they have?
Oh,
gosh,
how angry do they look at you right now?
Now, try, if you have to lessen it, try just a palm.
Yeah.
Yeah.
Try a palm to what is like the threshold. Same activation. The activation should make it much better. Yeah, and slowly let go.
Yeah.
There you go.
That is better.
Yep. I rarely find people where this truly jumps out first, okay? I usually feel incredibly victorious if I get it to go contract. And so, but usually when people have issues, if there's been knee problems for long enough, especially like osteoarthritis, they're not taking their knee into full extension anymore. Remember we talked about distorted gait? So this starts to really atrophy and just weaken substantially over time, and then connective tissue wise everything gets anchored down. So once the journey tends to be, if we can at least keep it active, good, but post any kind of intervention, especially full knee replacement, this is where we can be really helpful again. This is where I helped a ton with knee replacements. Has to be post-acute, like we're looking usually into like the, I'm being safe, 3-month mark for that. And then yeah, every time, every massage, making sure we're coming through, freeing this up and helping facilitate and activate that medialis. It's gonna be really important no matter what, either for long-term condition management prevention or for secondary rehab and therapeutic change. So that's I can't really actually show you a better thing to do for knee issues. That ends up covering a lot of your base, thorough work, thorough massage, plus this, solid go-to. It's never a bad thing to do.